The first lecture is not that long, and the second lecture is a bit longer than the first one. Would you like to have a break between the two lectures, or we continue? شو تفضلوا؟
اللي بريحك دكتور.
تمام. ناخذ بريك 5 دقائق بين المحاضرتين، ويبقى مفتوح الخط لأن هذا ما في تايم ليميت لمدة 5 دقائق، ونرجع للمحاضرة الثانية. Okay. Good morning. Today we will have a lecture about Trichomonas, and the disease caused by Trichomonas is called trichomoniasis, and some of the ectoparasites, external parasites, not inside the body, outside the body. We are going to describe Trichomonas vaginalis and other ectoparasites, which are external parasites like Sarcoptes scabies, الباراسايت اللي تعمل داء الجرب Sarcoptes scabies, and Thyras pubis. Thyras pubis اللي هي القمل أو القمل at the pubic area, which are transmitted by sexual means, because we are talking here about UGS. We are not talking in general. We are restricted by the UGS module. We are going to speak about their morphology, structural features, and life cycle. And briefly, we are going to describe some of the clinical presentation pattern, just a few lines, and the drugs, outlines of the drugs used for their treatment. Starting with the Trichomonas vaginalis, it is an oval in shape, and its nucleus also oval. Oval in shape of about 7 by 15 micron. It has also single elongated nucleus and a small cytosome. It's a mouth-like structure. Remember, cytosome, it is important in my talk about this parasite. This parasite has got 5 flagella. They arise from where? They arise near the cytosome, near the mouth. Their origin is near the mouth. 4 of them exit the parasite, exit the cell, يعني تطلع للخارج. The 5th one bends backward and run posteriorly along the outer edge of undulating membrane. في membrane يحيط الباراسايت متعرج. ونشوف هذا هذه 4 flagella, وال5th one run along the undulating. This is the undulating membrane. You can see it, elongated parasite, and the nucleus is also elongated. There is another structure called axostyle. It's a supporting rod containing microtubule. As you know, microtubule give structure to the organism. This is the axostyle. Run longitudinally. The axostyle is a supporting structure. Bisect the trophozoid, تقسم التروفوزويد longitudinally, and protrude through the posterior end for attachment. You can see it here. It protrude, يعني تبرز للخارج through the posterior end for attachment. This structure here is polymorph nuclear cells, just for comparison for the size. And this is a structure, real structure, EM structure, you can see what I have described. This parasite has got sort of movement which is described as jerky, non-directional. jerky زي ما تقفز تتحرك باتجاهات هيك non-directional، يعني مو تروح مثلا لقدام أو إلى الجانب، لا، non-directional haphazardly jerky movement it is described. This parasite Trichomonas vaginalis can be grown on artificial media under anaerobic condition. Remember, this parasite can be grown under anaerobic condition and at acidic pH between 5.5 to 6. Acidic pH. This parasite, again, different from other protozoa, they lack a cyst form. That is to say, they have only a trophozoid form. Okay? This is very important to know it. Trophozoid. It can survive outside the host for 1 to 2 hours, but it should be on a moist surfaces, not a dry surfaces. If on dry surfaces, they will die within a few minutes. In the urine, in the semen, in the water, they can be viable for 24 hours. You can say that a Trichomonas vaginalis is the most resistant to protozoan, the most resistant. It can resist these environmental factors. The disease caused by Trichomonas vaginalis is called trichomoniasis. It's a sexually transmitted disease, transmitted by sexual contact. Generally speaking, 25% of women are infected with this parasite. 30 to 70% of their partners also infected. However, this parasite is rare in virgins. So if you have a woman and you get positive result from her, you should ask her to bring her husband for examination, because 30% to 70% of their partners are also infected. Pathogenesis, this parasite can cause destruction of the epithelium of the genitourinary tract with inflammatory reaction, petechial hemorrhages. Their attachment to the host, to the epithelial surfaces of UGS, attachment by adhesine, and from the name is for adhesion, and also by laminin binding proteins, also by lectin binding carbohydrates. These elements, all of them, are used by the parasite for attachment. Adhesine, laminin binding protein, and lectin binding carbohydrates. Again, Trichomonas vaginalis produces an enzyme, or enzymes, you can say, which are called the proteinases. They destroy immunoglobulins like IgG and IgA, which can protect the area, the mucous membranes in particular, in the genitourinary system, and causes cytolytic effect with this enzyme. This parasite also can trigger TLR. What is TLR? These are toll-like receptors. أخذتوها بالإميونولوجي هذه. Toll-like receptors. These are used by the parasite for triggering certain cells for the immune reaction. And pro-inflammatory cytokines will be released. This will cause influx. Influx يعني bring in, تجذب polymorphic nuclear cells, خلايا phagocytic polymorphic nuclear cells, and CD4 positive T cells. Okay, I repeat this again. They trigger toll-like receptors, just can bind to certain cells through these receptors, and these cells release pro-inflammatory cytokines, which influx the polymorphic nuclear cells and CD4 positive cells. Following this is part of the non-specific immunity, innate immunity. Later on, the humoral and cellular adaptive immunity response, that is to say, a specific immune response, will follow. These parasites have the capability of escaping from immune detection by changing their surface antigenic determinants. So they can escape from the immune system. The clinical manifestations in females, this is very important and you should know it carefully. This parasite can cause persistent vaginitis. تقاوم escape from the immune system. It has a lot of resistant factors. We said is the most resistant of protozoan. However, 50% of the cases are asymptomatic. المرأة أو الرجل ما يحس أنه infected. The manifestations within 6 months after infection, 75% will have, women, let us speak, will have discharge, vaginal discharge. And this discharge is described as thin, yellow, and frothy. Frothy be زي الورف. Thin, yellow, and frothy. Sometimes we can distinguish between the different types of discharge. The discharge of candida, for example, راح ناخذها إن شاء الله بمحاضرة قادمة تختلف عن الترايكوموناس in description. And I will remind you when we will talk about candida with this point. 50% will have vulvar itching or burning sensation. 50% of women have dyspareunia. What is dyspareunia? Painful intercourse. 50% have dysuria, painful urination. And we have spoken about dysuria in the first lecture. 10% have disagreeable odor, رائحة. When you examine the patient have red vaginal and endocervical mucosa because of the inflammation. And these patients, because there is destruction in the area infected, and this area will be susceptible to HIV. And also, such women, when infected during pregnancy, they are susceptible for a preterm birth. الولادة قبل الأوان. A preterm birth. In men, urethra and the prostate are the site where trichomonal infection occurs. So remember, in the female, vulva, vagina, and cervix, mainly. In men, urethra, prostate are the main sites. Also in female, the urethra may be infected. Also, seminal vesicles, epididymis, can be infected beside the urethra and the prostate. Usually asymptomatic. And we said that usually 50% of the cases are asymptomatic. And with the urine current, the parasite can be removed from the urethra. The patient may have recurrent dysuria when symptomatic, and the scanty purulent discharge. In males, very small amount of non-purulent discharge. Purulent urethritis is rare, commonly non-purulent. يعني مو آثار كأنما قيح أو جراحة. And even sometimes this condition is suspected. It is non-gonococcal urethritis. Can be designated because it is not caused by Neisseria. It's not caused by Neisseria gonorrhea. So it is non-gonococcal urethritis. Diagnosis of trichomoniasis, identification of the organism. If we make wet mount preparation, شو هو الwet mount preparation? We put buffer, normal saline, a drop on a slide, and then with a swab, we put it on the, mix it with the drop, and then you put cover slide over it. This is called wet mount preparation. تاخذوها بالمختبر إن شاء الله. You can see motile organism. We say jerky, non-directional movement. The sensitivity of this test is 50 to 60%. You take from female a drop of vaginal discharge, or from male you take urethral exudate or urine sediment. ترسيب تبع اليورين، تاخذ اليورين وتعمل له centrifugation يطلع منه راسب. Or you can do it urine sedimentation after prostatic massage. We said it can infect the prostate. So if the doctor makes a prostatic massage, that is to say, put the finger and massage the prostate to make a fluid discharge from the prostate gland. There is another technique beside the wet mount preparation called direct immunofluorescence. It is more sensitive than the wet preparation. Its sensitivity is 70 to 90%. Culture also can be done. We said this organism can be cultured under anaerobic condition, but require several days for cultivation. Sometimes you cannot wait for it. This culture is usually done for research work, not for routine work. And recently there is what is called the nucleic acid amplification test, NAA methods, like PCR, for example, or a branch DNA method. This is the most sensitive and diagnostic method for the identification of the parasite, but this technique is expensive and not available everywhere. Treatment, oral metronidazole. A cure rate is above 95% in a single dose. Or you can use it over 7 days if the patient cannot withstand a high dose with a single dose. As I said from the beginning, simultaneous treatment of sexual partners. Because the patient is taking metronidazole, should stop alcohol. This is a Western country literature. You know, alcoholism is common in Western countries. So any patient taking metronidazole should stop alcohol intake. The drug metronidazole, should not be used during the first trimester of a pregnancy because of the side effects. Sometimes high dose for a long time of metronidazole may be carcinogenic. One should be aware about this point. So Most of the cases can be treated with a single dose or can be used for 1 week only, and everything will be okay. We come to Sarcoptes scabies, which is called 7-year itch, which is ectoparasite. And we have tackled this disease and this parasite previously with the MSS, you remember, in relation to the MSS. But today, because it is also related to the UGS, we are going to mention only few points about it, just for refreshment and to remember it, to keep it in mind. It can cause, this parasite, ectoparasite, can cause itch mainly at night, pimple rash, and I will show you a picture for the rash. And they cause boros in the skin, kuhuf, especially at the wrist, between the fingers, at the waistline, في الخاصرة. In immunocompromised patients, sometimes it caused crusty lesions, crusty scabies. A transmission physical, by close contact, sexual contact, and this occurs sometimes the physical contact because of crowded in prisons, for example, in some hostels. Diagnosis, you detect the mites or their eggs. The Sarcoptes scabies is considered as a mite, and their eggs can be detected. Treatment, we mentioned it previously. There is a drug called permethrin. Remember it, and I will come back to permethrin, which is also used for lice. It can be applied from the neck downward overnight, once, and the patient will be cured. If not, you can repeat it again. Other agents can be used like ivermectin and other antihistamine. Antihistamine, we give antihistamine. Why? Because of the itching. We said itching. حكة يعني. Antihistamine will helpful. Benzyl benzoate also can be used. This is what I have to remind you with the Sarcoptes scabies. And this is the mite of the Sarcoptes scabies. You can see it. We are not going to go into details, but this is the shape of it. These are the lesions or pimple called of the scabies. In comparison with the acne, حب الشباب هذا هو يظهر بهالشكل. mosquito bites, لدغات الحشرات البعوض. فإذا تفرق يعني. Where we see it, I said, between the fingers, at the wrist, at the waist, and also other areas, at the flexor areas, under the armpit or in the pubic area. From behind, also the same thing, between the fingers, at the wrist, and these areas which are colored in purple. The last thing, we are going to speak about Thyrus pubis. You should know how to pronounce it. Thyrus pubis, which is the pubic lice. القمل أو القمل في منطقة العنة, pubic lice, or crab lice. This type of lice, هذا النوع من القمل, common in the pubic hair. Sometimes it can infest the eyelashes. The condition is called, the disease or the condition is called pediculosis pubis, or can be called as thyriasis pubis. So you should know the names. Thyrus pubis, pubic lice, crab lice, the condition pediculosis pubis, or called thyriasis pubis. The patient develops itching, hypersensitivity to the parasite, macules also, skin lesions called macules. This parasite can be transmitted by direct contact or sexual contact. That is why we are studying it with the UGS, or through clothes or towels. If a person use a cloth or towels of other infected people, may get the transmission of the condition. In children, if you see it in children as a doctor, it raises a question that there may be sexual abuse. So one should be very careful. Sometimes it gives us a clue for such a crime. It is obligate ectoparasite. Ecto يعني خارجية. This parasite is smaller than the head and the body lice. تعرفون انتوا اللايس عندنا من تعمل infestation للhead وقسم منها للbody. We call them head lice and body lice. This parasite is smaller than the head lice and the body lice. It has a rounded body. Diagnosis, you detect the nits. What are the nits? كلمة nits شو تعني? Eggs of this parasite, which are whitish yellow. يعني بعض الناس بيشوفوها خاصة في بعض المناطق القروية يعرفها زي هيك حبيبات ناعمة بيضاء called nits. Also it has nymph. What is the nymph? Is larva-like structure, immature lice after hatching of the egg. فإذا أنا عندي egg, once hatch there will be nymph, and the nymph will become later on adult lice. So 3 stages: nits, nymph, and adult. The nits and adults can be removed by forceps, or you cut the hair. أسهل طريقة. Treatment, you could apply topically the permethrin, which I have just mentioned it for the scabies. Permethrin. هذا هو البيرمethrin. هذا red one. Okay? Or you can use pyrethrin على نفس النسق. Permethrin, pyrethrin. This is the blue one, is the pyrethrin. Or pyperonyl butoxide, which is a waxy white material called PBO, pyperonyl butoxide. Alternative to this treatment is lindane. However, lindane is neurotoxic. One should be careful in using it, since it is moderately hazardous. دي خطورة هذا neurotoxic. So the best one is permethrin or pyrethrin or pyperonyl butoxide. This is the thymus pubis. You can see the lice attached to the hair. Okay? And this is just illustration how the crab louse attached to the hair. This is the real picture of it. Any question? Any question شباب؟
دكتور ما عندي سؤال بسيط.
نعم عيني. تفضل.
البوليمورفو نيوكليار سيل ايش الرول تبعها بالترايكوموناس؟
لا هون بس لمقارنة السايز، للمقارنة هون. يعني هذا حجم البوليمورف نيوكليار سيل، هذا حجم الباراسايت، للمقارنة فقط.
ما لها رول معين
لا هون ما بدنا نحكي على رول، هون بدنا نحكي بالبيكتشر لمقارنة السايز حتى تعرف قديش كبرها لترايكوموناس فاجيناليس
تمام
شوي
دكتور.
أكبر من البوليمورف نيوكليار سيل.
تمام.
هذا
كان في بسلايد
المقصود.
7 مكتوب influx of polymorphic nuclear cell and CD4 فكان عندي سؤال إنه إيش وظيفتها؟
أنت إذا تيجي على أنا بدي أحكي على الصورة هسه لو تيجي على الباثوجينيسيس of course will be attacked by the non-specific immunity, which is mainly through the phagocytic cells, and also will be attacked by the cell-mediated immunity and the antibodies. Of course, this يعني. But we are not going to speak about the details of it. بس المقصود بالبوليمورف نيوكليار سيل هون لمقارنة السايز فقط. And you can see here the parasite and its structure are shown in relation to the size of polymorph nuclear leukocyte. تمام؟
تمام دكتور يعطيك العافية.
عفوا يعني. Other question? Okay. We will take only 5 minutes break لما تأخرنا وحتى أيضا بلكي بعض زملائكم يقدروا يلتحقوا فينا. We will stop this share up to here and then we will join within 5 minutes إن شاء الله حتى نكمل المحاضرة القادمة اللي هي شوي أطول من هذه. إذا see you then.